It's time to start getting you some answers here about the coronavirus from a local expert. Dr. Erika Hamilton, a microbiologist from UMass Amherst, joins us now by the phone. Hey, Dr. Hamilton, hope you're well.
I am well. Thank you for asking.
Not a problem, and we got some good questions to throw your way here today. The first coming from one of our viewers, Janet, and it goes, is it safe to open adult or senior centers?
This is a tough question to answer because with senior centers, it really comes down to this balance between risk and need, because senior centers really are very, very important for certain people in our community. So whether it is getting a hot meal at lunch or dinner time, getting a ride to a doctor's office, or just being able to go to the senior center for either an exercise class or a sense of community, they're super important. But we also all know that the people who are at most danger from COVID are those over the age of 65. So for individual senior centers, you have to look at things like how many people can we have safely in the building? How will we do social distancing? Will we be checking people's temperatures before they come in? Will we ask people to stay home if they're not feeling well? What will we do with someone if they come in and they're not feeling well? And what different activities should we be or not be offering for seniors? So there's a lot of questions to answer for that one.
Yeah, no doubt about that, and we cannot forget our seniors right now. The death toll with them has been catastrophic. All right, so switching gears here a bit, what should asthma patients do to remain safe when they're returning to work? We know air quality here in Western Mass, it's bad.
So people who have asthma are at a higher risk of having difficult complications if they get COVID. So if you have asthma, some things to think about. If you are in a work position where you can work in an office away from other people and stay 6 feet away, that's great. If you work in customer service and need to be like a cashier and you need to be face-to-face with people, hopefully there's an acrylic barrier between you and the customer. If not, you may want to ask to have one installed. Definitely wear a mask and make sure that the other people around you are wearing masks as well. And as usual, wash your hands and use hand sanitizer.
You got to police yourself and your surroundings there, no doubt. All right, doctor, final question here for you. Why are bars considered such a high-risk environment to spread the coronavirus?
Well, the purpose of a bar is to go to a place where you have a drink and possibly something to eat and socialize with your friends and family. And all of those activities put you at a higher risk for COVID-19. So if you think about what you do when you go to a bar, you get a beer, you sit, and you talk with people at the same table. Well, you can't wear a mask and drink a beer. We know that you need to social distance from each other, and that's sort of the opposite purpose of what a bar is. So that's going to be very difficult to do. Bars tend to get crowded. People won't wear their masks because they're drinking or eating and they're trying to talk. And we know that if you have your mask on, you can't hear very well what people's words are muffled behind a mask. And then let's face it, if you go to a bar and maybe you have slightly more than you should have, sometimes people aren't necessarily thinking about their actions and may start to get closer to each other because they're more comfortable and they forget about coronavirus precautions. So unfortunately, I know everyone would like to, a lot of people would like to go out to one, but there's a lot of things about bars that have risks to them at the moment.
And at least for now, yeah, that liquid courage, it can make one do a whole lot. Dr. Erika Hamilton from UMass Amherst, we appreciate your time today. And of course, we're going to have more of her insight here in the coming days. Keep tuning in, folks, right here at 12:30 on 40, as we're going to have Dr. Hamilton and other experts continue to answer your questions about this global pandemic. As you saw, we're just getting you answers left and right. All right.